So just so everybody's aware, if you'll turn your cameras off and your mics off as well, please, and just use the chat box for any questions that you might have. There'll be people in the background that will field those questions to the presenters for you. We've got a packed lineup for you this afternoon, along with a really informative breakout sessions to go on to. So we'll get going now because I can see numbers are going up. So questions in the chat box, please, for anybody that's presenting. And if you will, you'll wait for somebody to field your question over to the presenters. Thank you very much. So we'll start with, I'll welcome Sarah Pountain and Sarah Jones, who are going to give us a cervical screening update. Thank you, ladies.
Sarah, you're on mute.
Sorry. Right, let me just share our presentation. Just bear with me 1 second. Oh, no, shared you instead. You don't want to see yourselves. Okay, there we go. There we go. Can everyone see that?
Yes, thank you, Sarah.
Yep. Okay, great. My name's Sarah Jones. And I'm screening and immunisation coordinator working at the partnership. And Sarah, do you want to introduce yourself?
Yeah, I'm Sarah Pountain, working at the partnership managing cervical screening. I'm also a practice nurse by background and sample taker.
Thank you. So we've got a few updates and reminders for you about cervical screening. So I'm going to do the first part and then I'll hand you over to Sarah, who's going to do the second half. So first of all, I just wanted to share with you the uptake in all the areas of Greater Manchester for cervical screening. So this is from December last year, and it's the kind of December for the last 3 years. So obviously we've had 2 years of pandemic. So the uptake has obviously reduced. So you can see in almost every area there was quite a dip from this is 2020. No, that was 2009. No, 2019 to 2020, and then the grey one's 2021. So some areas have increased that slightly in the last year, but even last year, you know, a lot of places were struggling with staffing and appointments, and we did have the lockdown. So you can see on this link, which the slides will be shared afterwards, the uptake at a practice level. So you can look at your own practice, you can look at the practices in your PCN or in your CCG or in other CCGs, and see where you're up to, and see if there's any work that can be done to try and encourage those women who aren't attending to come in for their screening. So that's the uptake for the 25 to 49 year cohort, and then similar trend with the 50 to 64 cohort. So their uptake is generally a little bit higher than the younger ones, even though the kind of the peak incidence in cervical screening is around 30 years. So we do try and encourage practices to try and get those people who have just been invited in, so we can increase the uptake in that group. And again, you can see your own uptake on that link. So currently at the lab, the turnaround time for results is quite high. They are struggling with staffing and have a bit of a backlog. So it's around 42 days. It does go up and down depending on the situation, but just be aware that there is a delay there at the lab. So although some samples you will get back quite quickly, some will take a bit longer than this. So make sure that you're aware of that and telling patients that their result could take up to 7 weeks to come back. The current turnaround time is always on the CSTD, so you can check that quite regularly, but it's been around 45 days for a while, so just kind of expect it to be a bit longer. So if after the 7 weeks turnaround time your fail-safe shows that you haven't had a result back, then you should be contacting the lab just to check that the result hasn't got lost, the sample didn't get lost in transit, or that it wasn't rejected, and that you've missed